Hello and welcome to the Wellness Connection podcast. I'm your host, Fiona Kane. And today I have another guest. It's been a little while since I've had a guest, so it's good to have someone else here. So I'd like to say hello to Courteney Hills.
Hi, thanks for having me.
Hi, Courtney. It's good to have you on. And now we'll get into, we're going to be talking today about endometriosis. And I think it's a really important topic that still not enough is known about it. I heard a little bit of your story and I thought, okay, that's probably a really interesting and important story to share. So maybe to start by just telling us a little bit about yourself, Courtney.
Yeah, thank you. I am 26 years old. I work as a specialist veterinary nurse in a busy hospital in Sydney in the internal medicine department. I live in the beautiful Blue Mountains. I really love hiking, being out in nature, of course, all things animals, and yeah, just spending time with my friends and family.
Yeah, great. And so start telling us, actually, before we even talk about your story with endometriosis, and actually I'll just get you to speak a little bit louder as well if you can. You've got a quiet voice like me, so just try and speak up a little bit. But before we even start talking about your story, can you just tell us a little bit about what endometriosis is?
Yeah, so endometriosis is a chronic inflammatory condition, and it's defined as cells similar to the lining of the uterus. The word similar is really important. It's not the lining. It's tissue that looks similar, but pathologically under a microscope, it is different tissue.
Okay.
And it grows most commonly in the pelvis, but has been found in every organ of the body. Most commonly affects cis women, but has been found in fetuses and a handful of cis men in case reports, as well as some animals as well. And so it causes chronic inflammation and pain. It can cause adhesions, stick organs together, invade organs. It's kind of like a cancer, but not cancer. It kind of acts in a similar way. But yeah, they don't know how it's caused and what forms it. And yeah, they're still really researching this disease that's been around since the 1800s.
So I didn't know. Did you just say it can affect men?
Yeah, there's been case reports of it in cis men. Yeah.
I've never heard of that before. I didn't know how.
Yeah.
Yeah, okay. There you go. Learn something new. And just for the purposes of this, look, everyone's a bit different with their personal choice, but I don't use the term cis. I don't believe in using the term cis, but I'll just for those who maybe haven't heard of it, essentially cis refers to the fact that you're in the body that you haven't changed your sex or you're not trans or anything like that. So basically, a cis woman is a woman who was born as a woman, as a girl. A cis man is a man who was born as a man. But I just don't use those terms. I understand everyone's got their personal choice, but I think for the purposes of this, it might be confusing for people as well. So just basically woman or man. That's just forget the word cis for the purposes of this. I think it'd be simpler. But yeah, I had no idea though that it did affect men. So there you go. That's something, and also that you've just said they're similar to. So it's actually tissue that's similar to the lining, but not the lining.
Different. Yeah, it looks different pathologically when you put it under a microscope. It's not the same. So the first idea of it coming around, they thought it was the lining of the uterus that had flowed backwards and implanted like in the pelvis. That's what they initially thought, but that theory's been disproven.
Okay.
So it's some other tissue. They're not sure where it arises from.
Okay.
They know there's some sort of immune components and some genetics come into play, but there's not enough research. They don't actually know how it forms and what causes it.
Oh, okay. So it's not like, they know it's like a hormonal imbalance will drive it or that kind of thing. There's no specific
research. There is obviously a hormonal component. Endo can create it has its own receptors. So there's like estrogen and progesterone dominant endo. I have estrogen dominant endo. So it has its own estrogen receptors and it can also create its own nerves and things. So it is like a living tissue, but it's just causing damage and pain and inflammation.
Okay. All right. And that might be why one of the reasons that men get it as well then in that the hormonal component, because it's kind of this, not the same, but similar idea with, say, something like women will have, breast cancer that relates to estrogen and men will have prostate cancer. It's kind of a similar similar but different, but it's related to the hormones.
Yeah.
So maybe that's why
Yeah.
men
I think the
do it
thing
as
that
well.
most of us advocates are really trying to push for is moving away from it being a women's issue and a period issue. It's actually a whole body disease.
Yes.
People have lung collapses and need, surgeries from endo being removed around their heart. They need bowel resections. They can't walk because it's wrapped around their sciatic nerve. Like, it is a whole body disease. And
Yes.
because it's so, you have to go to a gynecologist to get a diagnosis, it's missing a lot of people, and it needs a multidisciplinary surgery team to remove it, not
Yeah, yeah.
not a
So it's
gynecologist.
seen as a women's issue. So therefore, like all women's issues, it would seem it's like, oh, that's not a thing, or it's or the whole thing that women are just bunging it on or making it up, or that sort of thing. I know there's someone in my family who has endometriosis, and when she was younger, it just wasn't taken that seriously, like her level of, because I suppose for women, it can be really obvious in the fact that it will actually affect your periods. So it'll affect how painful and how difficult that is,
Yeah.
which is probably why it's seen as a women's thing. But like you just said, it's a systemic issue, a whole body issue where it can
Yeah.
affect lots of things.
Yeah, yeah, and I think because there's so many period taboos, and menstruation is, not widely accepted. There's a little bit more acceptance now since I've, had endo, even in my personal circles. Like, I never used to talk about my periods, but now we all talk about them because, I've done lots of research and learnt a lot and read a lot. And if your period, there's something going on with your period, it's like a vital sign of your body. If your
Yes.
period is not right, then it means there's something else going on. It's
Yeah.
really
Yeah.
important. Our periods are so important for all aspects of our health as women. Ovulation is really important. All these things are so important.
Mm.
And yeah, I think taboos and patriarchal views, and that's why I
Yeah.
use the word cis, because a lot of people who are transgender, they even have to push even harder to get care because of all the biases and all those kind of gender things, and all the
Yes.
things in that
Yeah.
scheme. Yeah.
Yeah. Okay. So
Yeah.
then tell me just a little bit about your story then, as much as you're happy to share in regards to maybe when you first started noticing you had some issues and how long it might have taken you to get any kind of diagnosis, and then your path to sort of getting actual help and treatments and things like that.
Yeah. So I first started experiencing symptoms when I was about 14 years old. And then it took me about 7 years to get diagnosed. So my symptoms were initially just painful, really heavy periods. And then once I started getting bowel pain, and having painful bowel movements, that progressed to feeling like I was going to faint,
Mm.
before and during and after my period, with bowel movements. I was like, something feels wrong. I
Yes.
was working as a trainee vet nurse, and I kind of saw how the vets tried to figure out what was going on and how they could investigate the reason for something. So I went to a few GPs. I think I saw a total of 6 GPs before I pushed really hard for an ultrasound. Of course, the first thing they said was, "Oh, we'll just put you on the pill and that will, fix all your problems."
Yes, the pill is the thing that fixes everything, supposedly, isn't it? It's just like,
Yeah.
if we just stop you having a period, it won't be a problem. We don't have to think about it. And actually, that's what, just stepping back just a moment too, that's what I was going to say before when you were talking about the period, how important it is. It is kind of like the canary in the coal mine, isn't it? So it's kind of it can be one of the first things that you notice, or one of the things that goes out of whack to let you know there's something going wrong.
Yeah, yeah, for sure.
Yeah.
And we know that birth control and hormones don't treat the endo, they don't shrink the disease.
No.
They just mask your symptoms. And I wanted to know the cause and why. I've always, thought that I would want to have kids, and I was like, well, I'd like to know if my fertility is okay. I was 19 years old at the time.
Yes.
And luckily I had really good supportive parents, and they were like, no, we should investigate. And we do ultrasounds in my line of work. And I was like, why can't we do an ultrasound? There's no radiation. Can we just have a look? And it was COVID. It was in 2020. So it was like a phone call consult. So I had to be a bit rude. And I was like, can you just send me for an ultrasound? And reluctantly sent me. And then there was a big cyst on my left ovary. And so then I got referred to a gynecologist. And yeah, then I had to start like figuring out what this cyst was. Like the first thing you see when you look up ovarian cyst is cancer. So then I, started learning about endometriosis. A cousin in our family has it. So I was thinking, okay, the more I read, I thought, okay, I think I probably have endo. This is what my symptoms sound like. So just went to an OBGYN and was given the same advice to try hormonal birth control first, because that would help with my symptoms. And I was told that it would stop the disease from growing, which is not the truth.
Okay. So that's interesting too, because I've always seen it as like covering up the symptoms, basically dampening symptoms.
It's a Band-Aid. It doesn't treat the disease.
Yeah, but I didn't realise that. I just hadn't really thought about it, I suppose, because I don't have the condition, so I hadn't thought about it that deeply. But it doesn't. Not only does it just dampen the symptoms for a while, but it doesn't stop the progression of the disease. That's what you just said, isn't it?
Yeah, it doesn't. So, I had a few appointments with this doctor, and I had to push quite hard and advocate very hard for myself to have the surgery. So then I got the surgery in April 2021. And they found endo everywhere. I was so anxious before the surgery, which is such a common occurrence because we're so disbelieved and we have to push so hard. And in the recovery bed, when the doctor came to me and said, we found endometriosis, I was crying hysterically because I was I knew I was right. I knew something was wrong with me, but I was made to feel like I was, just making it up and it wasn't that bad. And so, they found endo all throughout my pelvis. I was told that it would be removed by excision. There's two types of surgery they do for endo. One is ablation, where it's basically just burning. So if there's a plant, they just burn the top of the plant off, leaving the roots, which leaves disease behind and has very high recurrence rates because the disease isn't removed and causes a lot of post-op pain. And there's excision, which is the gold standard treatment, where they proper dig out the entire plant, taking the roots and taking some margins, similar to how you would take out cancer or something. You want to fully remove it. I was told that I would have excision surgery, which I did have, but it was excisional biopsies. And the endometrioma, instead of being removed, wasn't recognized as an endometrioma, so it was left and it was actually drained. So then the doctor wanted to put a Mirena in at the time of surgery, and I didn't want that because I wanted to see how my body would go, and I was allowed to make that choice. And then I had some relief from the surgery for 6 or 8 months. I did feel a bit better. But then all my symptoms came back because the endo was still left in there. And I went back to the same doctor and they said to me, I told you this would happen because you didn't want to get a Mirena. And I didn't take anyone with me to the appointment, and I wish I had, because the look of shock on my face, I was just in disbelief. It's actually not my fault. And I just, it was a form of medical gaslighting. And then I think the look on my face, the doctor started backtracking a bit and said, oh, well, there could have maybe been some microscopic endo left behind. And by this stage, I'd had my diagnosis, I'd done a lot of research and reading and realized that we don't have any proper excision surgeons in Australia to fully remove endometriosis. So
it's not really done as much in Australia, maybe. So it's not really a specialty that people.
The surgery is done in Australia all the time, but the level of skill of the surgeons is not what it should be, and the training that they get. The OBGYNs in Australia only need to do 10 supervised laparoscopies, and then they're free to go.
Okay, so they just do 10 supervised ones, and then after that they can go for it, sort of thing. And are they more trained in the ablation as opposed to the? Did you call it resection? What
excision?
Excision. Sorry. Yeah. Sorry.
Yeah, that's okay. Yeah, I think they're trained in both. As far as I'm aware, there was guidelines put out before 2017 that said excision surgery was the gold standard treatment for endo.
Okay.
Then there was a national action plan put in place, and then they decided to sorry, I lost my train of thought. They changed the guidelines then in 2017, where excision surgery was not the gold standard treatment anymore, and hormones, GnRH agonist and antagonist drugs, complementary medicine such as acupuncture and physio, and then excision down the bottom of the list. So
Okay, so just let me get that, because so you've just said there that they changed the guidelines at one point and said that excision surgery was the gold star, but then they've gone back on that now. Is that what you just said? They've gone
yes,
back on that now and they use more hormonal medications and things?
yes, yeah. So
Okay.
there was a big movement in 2017 with endometriosis advocates in Australia using a hashtag saying change the guidelines.
Mhm.
And I was seeing all of that around the time of like investigating, and I was like, what do you mean, like we don't have the right surgery for this
Mm.
disease? So I spoke to lots of patients, made an Instagram account, just started researching, and I realized that there wasn't going to be a surgeon in Australia who could do the level of surgery that I needed.
Mm.
There's levels of endometriosis. They don't correlate to, or stages of endometriosis that don't correlate to pain, but they can give them a bit of an idea. So one would be like superficial disease, so very like minimal. And then it goes up to level 4, which would be deep infiltrating disease, which is what I have.
Okay.
And the more I read, the more people I talked to, and more stories I saw, I realized I needed to go overseas for surgery. So I had my surgery in Australia in 2021, and then in 2023, I got hospitalized while on holidays from an endometriosis flare. And I had to have, an ultrasound and a CT, and realized that the endo had progressed. And
Mm.
that was, pretty heartbreaking to realize all this disease had grown quite quickly and was now way more involved.
Mm.
And I had progression of bowel symptoms, and I thought, oh, I might need a bowel resection.
Mm.
And we didn't really have anyone who does those regularly in Australia. So I consulted with doctors in America, and a few other doctors in Sydney, and my ovary had 3 endometriomas on it, and the surgeons in Sydney were quite worried to operate on it and wanted me to freeze my eggs. Anyways, I connected with a patient online, and she told me about Dr. Mangeshkar in India, and he's the only multidisciplinary excision surgeon we have in the Southern Hemisphere.
Wow.
So I did a consult with him. He got me to do an MRI for surgical planning. And I didn't end up needing a bowel resection looking at the scans, which was really encouraging. But it was all over like the outside of my uterus, on my left ovary, my right ovary, around all the uterosacral ligaments that like hold up your uterus.
Mm.
There was a bit over my bladder and all down through my rectum as well, causing all of these symptoms. So, yeah.
It has a lot of characteristics that do sound very similar to cancer, doesn't it? It sort of sounds like, I suppose the only difference is I think cancer kind of eats tissue, doesn't it? Whereas I don't think this so much eats it, but because it adheres to the tissue, it can eventually do a lot of damage and a lot of inflammation, and then you might need to have resections and actually then lose tissue that way. Am I right in characterizing it that
Yeah,
way?
it like adheres to things and invades tissue, and people lose organs. Like there's silent kidney death with endometriosis.
Mm.
Like people, they have lost organs. So
Yeah,
yeah,
yeah. So yeah, essentially you could, kidney disease or other things like that, you could end up losing an organ because of the damage of this infiltration
yeah,
of this
yeah,
tissue.
yeah.
Yeah. Yeah, that's really, and that's, I think you're exactly right when you say this needs to be seen as, how did you describe it? A full system,
A full body disease.
full
Yeah,
body disease, because, it's not just like a women's issue. And even if it was just a women's issue, it still needs to be addressed because it's we're 50% of the population. And that's pretty, that's huge, and that's a big
yeah,
issue for
yeah,
50% of your population.
yeah. And
But
it's
yeah,
such a common disease too.
exactly. But
It's
from what
so
you're saying,
common.
it needs to be taken so much more seriously, because there's the level of damage that this can do systemically. It sounds like it's huge, and so it really, And it's just a shocking, isn't it? There must be so many people that don't even get a diagnosis, because I think, what did you say? You went to 6 or 7 GPs, you had to push to have the ultrasound. So someone who didn't have access to going to and for people, because a lot of people watch us who are in different countries, in Australia, usually the first line is a GP. So it's a general practitioner doctor we go to. So we don't go to specialists first, we go to the GP, because it's not the same in other countries.
Yeah, you have to
And
get a
then they'll send you
referral.
off. They'll refer you to a specialist. So most people have a GP or a GP clinic they go to, and sometimes it's different, but often it's the same person. So you've had to go to 6 or 7 different doctors, and then be pushy about it, and really advocate for yourself. And I don't mean push in a bad way. I just you
Yeah,
had to
yeah, I
push
had to
for it.
advocate very hard for
Yeah.
myself. Yeah,
And for anyone who maybe they're a bit nervous, they don't like asking for things from doctors, they don't know what to say, they don't have the right language, they just, or they, for whatever reason, just don't have that ability to get to a doctor and or ask for what they need, which would be a lot of people. There just must be a lot of people who just have this, and it's completely unsupported in any way, and
yeah.
completely missed.
Yeah, and I think the other thing is it's so expensive as well. Like
Mm.
ultrasounds are expensive, seeing a specialist is expensive. Like
Mm.
going to a GP is expensive if they don't cover you and pay you back. Like all these things are expensive, like financially, emotionally, like your time as well.
Mm.
Like, if you work full time and you're trying to manage a chronic illness, like, yeah, it's really hard. There's
Yes.
so many barriers to getting care, which is just ridiculous. This disease is as common as diabetes. Like it
Mm.
used to be 1 in 10 women in Australia. Now it's 1 in 7. I
Mm.
feel like it's probably more like 1 in 5.
Yeah, based on the lack of people being diagnosed, it probably would be.
Yeah,
And it makes you, I mean, obviously, who knows, but it makes you wonder, what are we doing? Is it, all of the plastics and xenoestrogens in our environment? I don't know what it is, but there's obviously things that we're being exposed to environmentally, and maybe that are changing our genetics or something. I don't know what it is, but something's obviously happening. Partly, one, it's obviously there's always that level of, well, they're getting better at diagnosing, so then more people get diagnosed. So there's that aspect, but I think it still sounds to me like it's more than that. That it's also, there's more of it as well. So there's more of it in the community, and it's being maybe diagnosed a bit more. But yeah,
yeah. And
that's
there's more awareness of it now and people talk about it. There's
mm,
people who've always had endo, but they were never allowed to talk about it, their symptoms
yes,
around their periods, or,
yeah.
the word hysteria like means uterus. Like, there's all of those other things throughout medicine and society that just create barriers to people getting the help they need.
Yeah, yeah. And because, even though I'm not a big one for talking about the patriarchy, that sort of thing, that's not my bag. But in saying that, from a medicine point of view, it was very much a patriarchal society, and women weren't really involved in medicine for a large part of it,
Hmm.
and so women's issues weren't even considered that much. Even just things like when we talk about sort of heart disease and that sort of stuff, there's a lot known about heart disease in men, but there's a lot less known about women, and we hadn't really focused on women. And so a lot of treatments and studies and preventative things are kind of about what they've seen in men, but not what they've seen in women. So yeah, that is an ongoing issue. So
Yeah.
heart disease, and that happens to men as well, but it's still male focused. So this is, because it's considered to be this women's issue, even worse, as far as like the amount of time they've probably spent studying it, looking at it, understanding it, and it's just a woman's issue. She's being hysterical. Give her
Hmm.
some Panadol, put her on a pill, so it just stops, makes the hormones stop, and she'll be right, mate.
Yeah.
Mm. So you got a diagnosis. You found out that there was this surgeon, and this surgeon is in India. Is that right?
Yeah. Yeah.
So tell us a little bit about, you made this decision to go and have surgery overseas. That must have been a bit scary.
Yeah, it was scary, but I don't know, I'm usually quite an anxious person, but I just like, I had done all my research, I'd asked all my questions. I just felt really confident in the decision.
Yes,
And luckily I was very well supported by my friends and family as well. Yeah, it was
yes.
scary, but I was at a point where I was so desperate for help. My quality of life was so poor. I
Mm.
just thought, you know, this is the best option for me and I just want to do it. Like,
Mm.
I'm 24 years old and my quality of life is so terrible. Like, I'm not doing anything fun or that I want to do. All I can do is work and rest. So, yeah, I did some Zooms with him and spoke to him online, listened to his podcasts, and spoke to other patients from New Zealand and Australia who had been to see him. And yeah, so Mum and I flew over there and I had the surgery and we had a consult before the surgery. He did some of his own imaging and we went through all my history. We looked at all the imaging. We came up with a plan and I stayed overnight one night in the hospital and then had surgery early the next day. And yeah, woke up and I felt amazing. I felt so much better than I have ever felt after any procedure in Australia. They
Wow.
use a lot of different drugs in India. They don't normally use opioid drugs.
Okay.
And their care is a little bit more like holistic. So I felt much better. And like 3 days after surgery, I was up and walking. I could walk, you know, without pain. My pain was very well controlled and my body just like felt better. I think
Mm.
I've spoken to a lot of people who've gone over and had this kind of surgery. And once that tissue is out of your body, like you just feel better because your whole immune system and your body's not fighting this inflammatory tissue.
Yeah, yeah, because your whole immune system would be just constantly activated, wouldn't it? So you'd have this constant, activation of the immune system and inflammation, and it
Mhm.
would be like systemic inflammation. So
Yeah.
I can only imagine if that tissue's gone, then your body
Yeah.
gets to sort of calm down and just begin to heal.
Yeah, so it was quite a big surgery. I woke up with a urinary catheter in, and I was lucky to be able to just lay in bed for like probably 24 hours post-op.
Mhm.
But yeah, there was 3 endometriomas on my left ovary, so they were all fully excised, and then my ovary was reconstructed. It was removed from like outside of my bowel, near my bladder, all in my rectum. It was deeply infiltrating. That was all removed,
Mm.
all behind my uterus, and yeah, basically my whole pelvis. My
Yes.
diaphragm was checked. There was none on my diaphragm, which I
Did
didn't
you
have
say you
any.
did have some on your diaphragm or
I
not?
didn't know.
Okay.
I didn't have any respiratory symptoms, but they always check, which is nice.
Yes.
Yeah, and then I recovered really fast. I
Mm.
felt really good. We had planned to stay 2 weeks post-op, but after a week's post-op check, we were cleared to fly. So we changed our flights and came home, and the flight home wasn't too bad considering I just had a major abdominal surgery. Like,
Mm.
I don't remember being in too much pain.
Mm.
And then I just recovered at home and went back to work, and now my life is totally different and I feel so much better.
Mm. And remind me, how long ago was this surgery?
It was in January 2024, so about 18 months ago now.
Okay. Yep. So and 18 months down the track, where are you now physically and how are you feeling?
Oh, I feel so much better. I have no pain at all, no period pain, no heavy periods, no bowel symptoms, no fatigue. Like, I don't have any endo symptoms at all,
That's
which is
amazing.
amazing. I can exercise without pain now. Before I had the surgery, I couldn't walk up steep stairs without pain.
Mm.
Now I just did the overland track with Dad, which is a 6-day overnight hike. That's like my bucket list hike. I have
Yeah.
energy to see friends again. I can just do what a normal 20-year-old person can do.
Yes. Yeah. That's
I have my
fantastic.
life back. Yeah.
Yeah. I'm so happy for you for that because I know that you've been through a lot. And when I first heard you were going to India, I was like, India? Who goes to
Yeah.
India? Because just don't know enough
Yeah.
about this. So who goes to
Yeah.
India for that? And I
Everyone
thought,
was the same reaction, like, what do you mean? We have surgeons here. I'm like, well, let me explain to you why. Yeah.
yes, yeah, yeah. So obviously, it makes sense now that you're explaining it to me. But I was like, "What?" But I also knew that you and your mum are very intelligent people, so you've obviously
Yeah.
done research. So I
Let's just
trusted
throw
that
them. Can't hear
you
you.
knew what you were doing. So and a little bit more. So the other thing that you mentioned to me before we started. So you've had another diagnosis recently that you think has contributed to some of your issues. So do you want to share a bit more about that?
Yeah, sorry, I just missed the question.
Oh,
It
sorry.
just dropped on
Uh,
me.
the internet is a bit funny sometimes. So, more recently, you've had another diagnosis and you've had another issue's been sort of cleared up for you and that's been helpful for you. Do you want to tell us a little bit more about that?
Yeah, I think the more I've learned about endo, there's a lot of comorbidities that come with endometriosis.
Mhm.
Um,
So comorbidity being another condition that is strongly related, or they can, I suppose, piggyback off each other or cause sort of combined problems or something?
yeah, so one of the comorbidities I already had was suspected adenomyosis, which is kind of like the sister disease to endometriosis, which is actually a uterine issue. Where the muscle layer like grows into itself, which you
Okay.
have to have a hysterectomy for it to be properly diagnosed. But I've got suspected, which explains some of my symptoms as well. But
Okay.
I have been doing really well post-op and was wondering why I'm still so exhausted. And being so unwell for so long, I was diagnosed with anxiety and depression and put on medications at one point, which didn't really help. And then I was speaking to some friends who were recently diagnosed and got an ADHD diagnosis and got some medication. And that again has been life changing because now I actually have energy. And we know that it's really common to have endometriosis and neurodivergence, so such as
Wow.
ADHD and autism. So I guess that's been another kind of like piece to the puzzle of figuring out what's going on with my health in general. And it's been so amazing. Yeah.
Yeah, so I didn't know about that the neurodivergence and endometriosis, they can it's more common, endometriosis in people with neurodivergence. Is that what you're saying?
Yeah, and other conditions like POTS, so postural orthostatic tachycardia syndrome, mast
Mm,
cell activation syndrome, EDS,
yes.
lots of things are comorbidities. Yeah.
Yeah, and see, a lot of these things are kind of, full system, inflammation and immune issues and immune response issues. So, yeah, it's just there's a lot going on with our immune systems in the last few years yeah, a lot of these things are increasing and, yeah, I've got lots of suspicions about lots of things that might be contributing
Yeah.
to that. But there's something going on in the fact that, once upon a time having something like an autoimmune disease was quite unusual, where it's now, I could name 5 people just around me, actually even in my family now. For a long time, I was the only one in my family that I knew of who had an autoimmune disease, and now I could probably name 4 people straight away. So
Hmm.
yeah, a lot's changing as far as there's a lot more conditions that are affecting the immune system and immune system and inflammation. It kind of goes together. Anything that
Yeah.
goes wrong with the body, there'll be inflammation.
Hmm.
Inflammation is part of it, or inflammation is part of how you know you have the issue. But
Yeah.
yeah. So you find that what you were saying there is, a lot of people, of course, it's one of those things, right? Because when when you have a lot of pain and when you're going through a lot of pain and especially if there's like misdiagnosis or you're not getting the support or the help you need and things aren't getting better,
Hmm.
of course, part of that you would feel depressed or anxious or those kind of issues anyway. So part of it would be just in response to your reality, which is your reality is pretty awful. So of course you start
Yeah.
feeling that way, and then there's probably the element of that because there's a hormonal attachment to or hormonal issues, then obviously hormones out of balance would also contribute towards that. But then on the other side of things, you're saying that anyone who's sort of got any kind of neurodivergence, whether it might be autism or whether it's ADHD or something like that, that also will affect sort of the energy and the mood and that sort of thing. So that's what you're saying you found, and that since you've been treated for ADHD, that's really improved your energy. Is that kind of, am I on the right track there?
Yeah, definitely. Because I was like, I physically feel better now. Why am I still so exhausted? Like, why do I not have the energy to, socialize with friends and things? So, yeah,
Yes.
it's been amazing. Yeah.
Yeah. And again, you're someone in your 20s, so that's when you're supposed to have energy. So it doesn't make sense for someone in their 20s to be so low in energy.
Yeah.
Yeah. And so okay, so it sounds like you're doing really well at the moment. And what have you got any sort of future plans or anything that you want to share with us about what you're doing, or it sounds like you're wanting to do a bit of advocacy work as well. Is that sort of where you're at?
Yeah, I have been doing it throughout my journey, but now I have like the energy to I guess kind of get my story out there and answer questions. I get a lot of
Yes.
messages on my Instagram, and I try and help people as much as I can on there.
Mm,
I get questions from people all over the world asking about my experience with surgery, because it's not
yes.
just Australia where people are struggling to get the endo care they need, it's worldwide.
Mm,
So, yeah, I think just advocacy and I don't know, maybe organising events in the future and meetups and things. But yeah, I
mm,
think just being part of a patient community, that was so helpful for me. And
yes.
like without the Instagram community on, the endo community on Instagram, like I would not have heard about Dr. Mengs, and I wouldn't have known to go to India. I would,
Mm,
I think it would take me a lot more time, and I possibly would have just had another surgery in Australia, which, wouldn't have gotten me where I needed to go and could have caused more issues. So, yeah,
yeah.
that's kind of my
Yeah.
future plans.
And in Australia, is there a push to change the guidelines or change the recommendations around this? Because I recently heard something that said, am I right in saying that in Australia recently they're not even recognizing endometriosis? Or what was it that I heard recently? There was something in the news about that. So do you know where we're at as far as in Australia about diagnosing and treatment for endometriosis?
Yeah, where we're at, there's somewhere between about 80 to $100 million that's been put towards endometriosis. Unfortunately, none of it's going towards surgical training. Most of it's going towards research
Mhm.
and for setting up pelvic pain clinics. But yeah, none of it is being put aside for training surgeons.
Oh, that's a shame. So obviously research is important and obviously
Yeah,
pain is important, but you might not need the pain clinic if you had surgeons that were trained in, based on your story, and you're obviously not the only one because you spoke to other people about this beforehand, that you think that putting more effort into training people to do the surgery, that's your pain clinic for you. That's your less need for the pain clinic if you're able to resolve the issue, isn't there?
yeah, definitely.
Mm,
There's about 200 excision surgeons that are multidisciplinary of like the skill set that I went and saw in the world, and there's uh, millions and millions more people in the world with endo. So there's a lack of actual you know access to these surgeons. It's
yes.
really hard to find them, and when you do, you have to travel overseas, which is
Mm,
crazy. Like we shouldn't have to do that. We should be able to go to a surgeon in Australia.
mm. Well, there's a recommendation for anyone who's looking for a future work, a future job that they'll get a lot of clients, patients with is if you're doing medicine, maybe consider doing surgery, this kind of surgery, because obviously there's a great need for it,
Yeah.
and we more people need to be trained in this. But even just being trained in it, do they train much for that in Australia? Do you know much about? You might not know.
No,
It's fine
they
if you don't
don't
know.
do a lot of training for it, and it's normally lumped within OB/GYN. But to have a
Yes,
proper, like a surgery similar to mine, they need to only be doing endo surgeries. They can't be delivering babies and doing other surgeries. It needs to be only
yeah,
endo,
yes,
because that's how you get the skills. Because it's a really difficult surgery, and it's different to a cancer surgery where you just want to get the cancer out of the body. But most of the time, it's younger people who have the rest of their lives ahead of them. So you can't just
yes,
remove an organ. Like you've got to try and preserve fertility as well, because that also plays a
yes,
big role. So it's a
yeah,
really tricky surgery.
yeah,
I had to
yeah.
have robotic surgery, so it had to be really precise, and nerves, pelvic nerve sparing, and trying to preserve your fertility and all your organs, and your pelvic floor and all those muscles and things, like they're so important for bodily functions and everyday
Yes.
life, let alone people who have it in their lungs and get lung collapses every month. Like,
Mm.
yeah, it's
Yes,
important.
I didn't even I had no I suppose it's one of those things that, vaguely aware of when it's not your situation and when you're not around people with it. I had no idea that people had lung collapses from the invasion of this tissue into their, you know, into that in that part of their body. I just had no idea.
Yeah, and it's kind of seen as rare for people to have it like extra pelvic endo, like outside the pelvis, but it's
Mm,
really not rare. It's just not recognized, or we don't have anyone in Australia who can treat extra pelvic endo. There is not a surgeon who can do a thoracic surgery in Australia to remove
yeah,
endo from your lungs. So
yes.
I've talked to personally a handful of patients who have to go overseas. And it's really expensive as well. Like, it's so
Yeah.
expensive to get these surgeries. And yeah,
And
people are chronically ill, they can't afford to work. Like, there's just so many barriers, and it's just so upsetting.
and have you had any contact with any of your doctors since you came back to Australia to talk to them about the success of your surgery?
I've spoken to my GP, who is really supportive and super helpful. After
Yes.
going through all those GPs, I finally found a really good GP, and she's wonderful.
Mm,
So I've spoken to her. I've spoken to my pelvic physio, my acupuncturist, my naturopath, and they're all like, "Wow, this is so good,"
mm.
because like the recurrence rates in Australia are so high. It's like somewhere around like 70% recurrence within 5 years because the disease isn't removed. Whereas my recurrence rate is less than 3% for life,
Okay.
and a little bit higher because I have endometriosis, and because I ovulate, it's more, there's a greater possibility for it to form. But those kind of like recurrence rates are not seen anywhere in Australia.
Yeah, yeah. So that's phenomenal. That is, that's amazing. Well, like I hope over time, some of your doctors you speak to. I suppose all you can do is tell as many people as you can about this, get the word out, and I suppose things begin to change when. Maybe there needs to be the groundswell of people. You know, it's going to be this. It's going to be the rising up of the people to ask for change, and
Yeah.
maybe that's the way it's going to have to happen. And there are, I suppose the other good thing, I suppose, is one good thing about there being more women involved in politics and all sorts of organisations like medical organisations and things like that is will advocate. Not that it's a women's issue solely, but just because it is seen as one. But I
Yeah.
really think they're rebranding or is there? I assume there's some sort of association. Is there? What's it? Is there like an organisation or an association that you're involved in who is behind this, trying to rebrand this disease in a way and get more attention for it?
There is a government organisation that I won't name who get a very, very big amount of the funding for
Yes,
endometriosis in Australia and decide where that money goes.
yes.
But they are not very supportive of advocates like
Okay.
myself. So,
Yeah,
yeah,
yeah. Unfortunately, some organisations for issues and diseases are more about managing it and medications and all about just supporting keeping the status quo,
yeah,
and some are more about advocating for change and improvement and whatever it is. So,
yeah. There
so
was
yeah.
actually a study written last year about endometriosis advocates on Instagram. Um, so they spent some of the funding to data mine our accounts, and yeah, basically call us out about false information on the internet. So
Oh, okay.
yeah,
So yeah,
there's a
so
lot of tension.
yeah, yeah. It's one of the thing about, in my experience, the thing about even in whether it be nutrition science or in medicine and all of these things is I think that's always seems to have always been the case. That one, it's like we think we know how it is, and this is how it is, and this is how it works, and this is how we've always done it, or whatever it is, and so we just get very stuck in our ways. The other thing is that, and there's a lot of ego involved in these industries, so people don't want to admit they're wrong. But then on the other hand, too, when you think about a lot of people who are influencing these industries, there's a lot of money to be made from someone who needs to go back every 5 years and someone who's using different hormonal medications or IUDs or all the things. So,
Yeah,
so there's probably a certain level of, and this is me, look, hey, don't sue me. This is just me just theorizing, and I don't know enough about it to know. So it's just all I'm doing is theorizing. But I'm just theorizing that there's a lot of influencers who probably don't want things to change, who are probably very influential, and they're probably part of what's going on here as well. So it's probably a bit of all of those things, a mixture of we've always done it this way, ego, and some big funding people maybe who have vested interest in it staying a certain way.
yeah,
I don't know. Yeah.
for sure.
Yeah. So anyway, it'd be people like you getting the word out that will make a difference, and every every opportunity to speak is worthwhile to teach people more about this. So, is there anything, thank you so much for sharing that story, because I know it's been a really hard, really, really challenging story for you, a challenging time. Your life, you've had a lot of challenge in and around this, and I know it's quite personal. So, I really appreciate you sharing that today.
It's okay. Thank you for having me on.
Yeah. And is there anything else that you would like to add? Is there anything that we didn't talk about or that you think is worth mentioning before we wind up?
I think my advice is always just trust yourself. Like, you know your body. Don't like take an answer and run with it. Ask more questions, see another doctor, speak to other patients, like just keep advocating for yourself. And just, I don't know, don't give up, I guess. Don't lose hope, because there are people in the world who know about this disease and do want to help you. It is hard to find them, but they do exist, and there is some hope. Yeah.
Yeah, definitely. Don't lose hope. Get in contact. We'll talk about your contact details in a moment. But the other thing, I suppose, like what you were saying there is, you know, one thing that I try really hard to teach my clients and teach people is to really tune into your body and really know yourself. And we do often really know ourselves, and don't underestimate your ability to know that there's something not right. And you hear this a lot with people, whether it be cancer diagnosis or some other diagnosis, but they say that, "I just knew something wasn't right, but I couldn't convince my doctor," or whatever the situation is. If you just have that instinct that something is not right, please keep following it up and if one person doesn't listen to you and you have access to others, just like, sometimes you might have to go through 6 or 7 doctors before you find one that will help you. But please keep going with it, because it's really, really important. And once you do get that right diagnosis and you get more information, you can do something about it. But yeah, I think really it's important to listen to our instincts. And I know that some people in the medical fraternity understand that and do really pay attention to people's instincts. Some don't, but don't undervalue those. They are really important. And yeah, don't lose hope.
Yeah.
And thank you for being here to give people hope
No,
today.
it's
Now,
okay.
if people want to get in contact with you, obviously we will put your details in the show notes. But what's the best way that they can contact you and find you?
Yeah, on my Instagram account, it's at EndoVetNurse.
So at Endo Vet Nurse, is that it?
Yes, yeah.
Okay. Thank you so much, Courtney. Thank you for talking to me today.
That's okay. Thanks so much.
And thank you, everybody, for listening and watching. Please like, subscribe, review, and share episodes. And particularly this one, I'm sure you know people who are experiencing some of these issues. So please, just take the time at this moment just to click on the share button and share this with your friends or family or whoever you know who might be touched by this, because it really is important that we get this information out. It affects so many people, and it is, a full body systemic issue. So we really need to take this very seriously and get help. And hopefully someday in the future we'll be coming back and talking about how they're doing this in Australia, and there's lots of surgeons, and I've been around for long enough to know that these things take a lot of time. Eventually we get things in the right direction, but it can take a lot of time. So, look, thanks again, Courtney, and thank you everyone for listening and watching at home. The point of this podcast is to have real conversations about things that matter, and this is definitely one of those things. So thanks everybody, and I'll talk to you all again next week. Thank you. Bye.